Good morning, Ioannis. Thank you for having me. It's a pleasure to be here in your hospital and to come and see how you work. I have a question for you because it's been many years. Of course, I'm a bit younger urologist than you, and so sometimes I come across the request to do some live surgeries or semi-live surgeries. And for me, live surgery is still something that causes some concerns, anxiety for some reason, for example, unfamiliar environment or the need to talk in front of an audience. And I just wanted to know, because you're more experienced than me, how is it for you and how it was when you started?
So first of all, it's a big pleasure and honor for us to have you here. And so these are many questions rising about how we can manage, for example, the stress of the live surgery, how we must be prepared, how we can be prepared for the best of the patients. There are some ethical concerns, logistic issues. For sure, it is something challenging. It is something that it's not your routine. It's not like operating in your operating room. The environment is different. There is an audience, and you know there is an audience. It is also different from like being a proctor or a tutor. For sure, it was difficult. It was stressful. But I think if you realize that your main objective is to do your work as usual, that means for the best of the patient, you can get somehow isolated from the environment and perform the surgery thinking about only the patient. By doing this, you, I think, resolve this performance, let's say, stress and anxiety. Of course, the more live surgery you do, the more experience you have. It is like a personal reward. So yes, it is challenging. Maybe it's not for every surgeon, but the feelings that you get of satisfaction are really great.
Thank you. That's very helpful. I think, like me, many other urologists are still in doubt whether this is something that we should continue to do, because, as you said, it's an ethical issue sometimes. But of course, if you're doing the best for the patient and you will do the same that you would do at home, then maybe you overcome this ethical issue and you just dedicate what you're doing to the patient benefit, no? I was thinking, when I go to a conference, for me, it's very nice to see a live surgery operation. I still think that I learn a lot. So it's got a very high educational value because you see live in real time things that instead maybe in the semi-live or pre-recorded cases are a bit edited. You never know if everything is shown. So for me, the educational value of the live surgery is still very good.
I fully agree with you, and I always tried to follow the live surgery before performing it, because it gave me many useful information for my daily practice. In the semi-live, you have a selection bias, let's say. Okay, you select certain cases that maybe are the most easy or the most clear cases. So this is not real life actually happening right then, right in that moment. So I think that live surgery has many benefits for educational purposes. Of course, there are ethical issues, but if we get very well organized, and who organizes the live surgeries prepares everything in the right way, then I think that the ethical issues can be easily be resolved.
This was a very constructive talk. And do you want to know what other people think, what our colleagues think? Because we've created a very nice survey. They will capture all the opinion of surgeons, people who've done live surgery, semi-live surgery, or just people who've watched it. And also it asks you, how would you do if you were in the patient's position? Would you like your operation to be streamed live, like live broadcast, or better semi-live? So let's see what our colleagues think.
It is, I think, a fantastic idea, brilliant idea, and I think that it is something we need. We need to gather information and the opinion of our peers. It would be extremely useful to see what our colleagues think about it. As maybe surgeons that they perform live surgery, as attendees that they would like to see live surgery, and maybe as patients, being the patient, what would you think? How would you feel it? So I think this is a fantastic opportunity with this surgery to gather information and understand what we can do next to maybe improve certain aspects that are very important. So go for it.
Thank you. Yes.
Okay. Bye.
Bye. Do the survey.